Namaste, I'm Dr. Amit. So in the last couple of videos, we have completed tissue distribution of adrenergic receptor, that is alpha 1, alpha 2, beta 1, beta 2 and beta 3. And now we'll move forward in our pharmacology video, and today we'll talk about tissue distribution of cholinergic receptor, and we'll talk about M1, M2 and M3 receptor. So let's start our tissue distribution of cholinergic receptor. Okay, so before we begin, we all know that cholinergic system is any nerve or any receptor that uses acetylcholine as neurotransmitter, and we all know that this cholinergic system is especially for rest and digest. Okay, so from our very first video, we all know that we have a parasympathetic and sympathetic nervous system, and today we are talking about this cholinergic system. Okay, so there is a preganglionic neuron which releases ACH, and the postganglionic neuron will also release ACH, and this ACH will bind to this cholinergic receptor M1, M2 or M3 in the effector in the organs, and it will produce effects in those organs. Okay, so how it actually works. So as I have already said, that ACS bind to receptors, that is M1, M2 or M3, any receptors which is present in that organ, and it activates G protein. So these cholinergic receptors are also G protein coupled receptor. It means that when G protein get activated, it produces secondary messenger, and this secondary messenger will produce physiological response. That response can be anything, like in the heart it may increase or decrease the heart. Okay, then in case of GI system, it will produce effect. In brain also it produces effect. So wherever it is present, it will cause some physiological response. So we all know that the cholinergic receptor is of three types, that is one M1, one is M2 and one is M3. So just remember a simple rule before we enter in the details of these receptors. Okay, that M1 and M3 are G protein coupled Q class receptors. Okay, and it increases the intracellular calcium. Okay, so it increases the calcium in the cell, and it will stimulate the secretions and causes the muscles contraction, stimulate the muscle contraction. And this M2 is a G protein I class receptor, and it decreases the cramp and it slows the heart. So it works mainly in the heart. Okay, so this is all. Now let's start about M1 receptor. So let's talk first about M1 receptor. Okay, so first thing is where it is located. So these M1 receptors are present in our brain. Okay, after that, our enteric nervous system, that is enteric nervous system simply means the nervous system of your GI system. Then gastric parietal cells. Okay, so in the gastric parietal cells also it is present. So let's first talk how it works in the brain. Okay, so in brain it helps in higher cognitive function. Okay, so what actually happened? We all know that in our brain we have cerebral cortex and hippocampus. We are familiar to these names. Okay, so in this cerebral cortex and hippocampus, there is presence of M1 receptor. M1 receptor is abundant over here. So when the M1 receptor of this cerebral cortex and hippocampus get activated, this area is responsible for learning and memory. It means that when it is activated, it helps in learning and memory like things. So how it actually happened? So when ACS bind to M1 receptor of cerebral cortex or hippocampus, it increases the neuronal activity, and when the neuronal activity will increase, it helps in learning, it helps in memorizing things, and it helps in attention to improve. So if any patient is having no good learning response or no good memory, or if there is attention deficit, so we can say that there might be problem with M1 receptor, or there might be less ACS to work. Okay, so let's have a clinical correlation. Okay, so we all know a disease about Alzheimer. Okay, so in Alzheimer disease, the patient is having memory loss, confusion and difficulty learning. So actually what happened in Alzheimer disease, there is a reduced ACH in the brain. In the brain, the level of ACH decreases. Okay, and there will be degeneration of cholinergic neurons, which and these neurons uses ACH for the function. Okay, so when there is reduced ACH in the brain, so no ACH to bind on the M1 receptor, so there will be memory loss, confusion and difficulty learning in the patient. Okay, so this is how and this is why Alzheimer disease occur in a patient. Okay, so what actually we do? So when we talk about the treatment of the patient, we give donepezil or rivastigmine or galantamine to those persons. Why? Because it inhibits the acetylcholine esterase. So as we all know that acetylcholine esterase is that enzyme which break the ACH. So if ACH will break, then there will be again more less ACH in the brain. So when we inhibit acetylcholine esterase, then ACH level will increase, and when ACH level will increase, there will be cholinergic transmission, and the symptoms like memory loss, confusion and difficulty learning will start getting improved in those patients. So this is how it works in Alzheimer disease. Now let's see how this M1 receptor works in enteric nervous system. Okay, so as we all know that enteric nervous system is what? It's simply a nervous system of our GI, that is stomach, duodenum, large intestine, small intestine. Okay, so in those systems the nervous system present, that is called as enteric nervous system. So what actually happen when M1 receptor get activated in the enteric neurons, more intestinal activity will increase. Okay, so when the more intestinal activity will increase, it will helps better in digestion and gut activity. Okay, so this is how M1 receptor works in our brain and enteric nervous system. Now we'll start talking about M2 receptor. So now let's focus on M2 receptor. Okay, so the first thing is where M2 receptor actually present. Okay, so its location is SA node, AV node and atria of our heart. Okay, suppose this is our heart, then in SO node, then in the AV node and in the atria. Okay, it is present. It is less effective in ventricles. Okay, so how it actually works? So first let's how it works in heart rate. Okay, so when ACS bind to the M2 receptor of the heart, so there is, suppose this here is a M2 receptor. Okay, so when ACS bind to this M2 receptor, then what happen? This G protein get activated. When G protein get activated, in those conditions the CAMP decreases. Okay, and when CAMP decreases, then there will be less calcium entry into, suppose this is a calcium, then the calcium entry into the atria will, or in this heart will decreases. Okay, and when it decreases, the SA node over here fires slowly and the heart rate decreases. So this is how it works. Okay, suppose this example is when you were sleeping. Okay, during sleeping or resting stage, we all know that our parasympathetic nervous system dominates in those stages. So in that stage our heart rate is decreases. Yeah, it helps to conserve energy. Okay, so this is how it works in our heart. Now let's talk about how it's working atrial contractility. Okay, so we all know that where there is a atria and ventricles in our heart, so it helps in atrial contractions. Okay, so how? So less calcium enter the atrial muscles. Okay, so atrial contractions become weaker. So when M2 receptors of this atria activated, then the calcium will enter less. When less calcium will enter, then atrial contraction will decreases and it will decrease the contractions. Okay, but its effect on the ventricle is very less. So why it is clinically important? Okay, suppose if you have any patient in the ward or in the emergency room anywhere having a symptomatic bradycardia. Okay, so we all know that bradycardia is why, because it might be because of M2 receptor is activated, because M2 receptor decreases the heart rate. So we have to give any drug that will cancel the effect of M2 receptor. It means that M2 receptor antagonist. Okay, so atropine is a drug which blocks the M2 receptor. So when the M2 receptor will block, then there will be no more decreased heart rate. So the parasympathetic nervous system will be removed and the heart rate increases. That's why we use atropine or block M2 receptor blocker in case of symptomatic bradycardia. So this is about M2 receptor. Now we'll move forward and we'll talk about M3 receptors. Okay, so M3 receptors are mainly found in smooth muscles. Okay, so smooth muscles are found in different parts of our body, like in uterus, in blood vessels. Okay, so in different organs we found smooth muscles. So in those smooth muscles M3 receptors is present. Then exocrine gland, we all know that in our body there is endocrine and exocrine gland. But in case of exocrine glands are those glands of our body which produces substance and releases it through gut on the exterior of our body. Okay, then in eye also it is present, and then endothelium, that is in the endothelium of the blood vessels. Okay, so just think that M3 receptors are receptors for movement and secretion. Okay, now we'll see how it actually works. Okay, so in exocrine gland secretion, so when you look in exocrine gland where the M3 receptor is present, so when M3 receptor get stimulated in exocrine gland, it increases the secretion. Okay, how? Like in case of in salivary gland, in lacrimal gland of the eye, then in bronchial gland and in sweat gland. Okay, so we all know that there is an exception that of the sweat. The exception is that sweat gland is actually a sympathetic nervous system part. Okay, but actually it releases ACS. Normally it releases norepinephrine, but sweat gland is the exception where the postganglionic neuron release ACS and it works on the M3 receptor. It doesn't work on the adrenergic receptor. Okay, so just remember, this is very important for MCQ point. Okay, So in the sweat gland also, the exception sympathetic cholinergic. Okay, so how actually it help? Okay, clinically, just remember. So whenever you see any delicious food, okay, so you immediately start salivating. Okay, why? Because your M3 receptor of the exocrine gland of that salivary gland get activated. When the M3 receptor of salivary gland activated, it start produce saliva in your mouth. Okay, so this is a clinical example. Now let's see how it's clinically correlate. Okay, so we all know there is a drug called atropine. Okay, so we talked about that atropine is given in symptomatic bradycardia. So when you give atropine to any patient, it will block the M3 receptor. Okay, so when the M3 receptor will get blocked, then there will be dry mouth, because the M3 there will be no salivation, there will be dry eye, and there will be reduced sweating in the patient. So these are the side effects of atropine, because it blocks the M3 receptor. So this is how it works in exocrine gland. Now we'll see how it works in cord peristalsis. Okay, so M3 receptor is present on the intestinal smooth muscles. So as we all know, that is present in smooth muscles also. So in the smooth muscles of the intestine. So when these receptors get activated, it will increases the peristalsis, that is movement. Okay, so peristalsis will increase, so the food will move efficiently through the gut towards downward. Okay, and it helps in digestion of the food. Okay, so how it is clinically correlated, that after abdominal surgery, okay, so if any person is having abdominal surgery, so patient may develop post-operative ileus, that is decreased bowel movement. Okay, so it's because of this M3 receptor that causes the bowel movement to decrease. Okay, the M3 receptor get blocked. So block will be the not right sentence. It means that it simply means that whenever there is abdominal surgery, then the sympathetic activity of the patient will increases, and there will be less acetylcholine release. So if there will be less acetylcholine release, then the M3 receptor, that is cholinergic receptor, will not work properly, and that will cause what? Post-operative ileus, that is decreased bowel movement in the patient. Now we'll move forward. Now we'll see that how it works on the bladder. Okay, so in bladder there is also presence of M3 receptor. Okay, so in bladder there is the location will be on the detrusor muscles. Okay, so when suppose this is detrusor muscles, when this M3 receptor will get activated in these detrusor muscles, then the urination will occur. Okay, so basically it contract the bladder. Okay, so this bladder get contract and the patient start urinating. Okay, so what's the clinical correlation? Suppose that any patient, suppose this is a patient. Okay, and this patient is having urinary retention, that he's not actually passing the urine. So in those conditions, we can give any drug that will work on the M3 receptor and helps to start urinating. Okay, so that's why what's written in the clinical correlation, the patient with urinary retention may benefit from a drug called bethanacol. Okay, because it stimulates the M3 receptor and helps in emptying the bladder. Okay, so this is how it works on the bladder. Now let's talk about bronchi. Okay, so how it's work on the bronchi. So suppose this is a lungs. Okay, it's a bad diagram. Okay, so suppose in the lung also there is a in the bronchi there is a M3 receptor. So when M3 stimulations will occur, then the bronchial smooth muscles will contract and it will increases the bronchoconstriction. Okay, so basically when M3 receptor is activated, it causes bronchoconstriction. So let's see clinically how it is important. So in asthma or COPD patient, this worsens the airflow obstruction. Suppose if there is any patient with asthma or COPD, and if the M3 receptor will get activated, then it will cause more bronchoconstriction. So it means that the patient will have more symptoms. So in those conditions, we need to give any drug that will block the M3 receptor, that is ipratropium or tiotropium. So we give ipratropium or tiotropium that will block the M3 receptor and causes bronchodilation. It will not causes bronchoconstrictions. Okay, this is how it helps in asthma and COPD. Now let's see how M3 receptor works on the blood vessels. Okay, so this is a very exam favorite topic. Okay, so actually the blood vessels, okay, so blood vessels in our body have a little parasympathetic innervation. Okay, little. So the endothelial cells, we all know there is a endothelial cells in the blood vessels. So in the endothelial cells there is a M3 receptors. Okay, so when ACS bind, that cholinergic receptor ACS bind to this M3 receptor, then nitric oxide get released, and this nitric oxide diffuses to the vascular smooth muscles present in the blood vessels. Okay, and that will helps to smooth muscles to relax and causes vasodilation. So blood vessels will dilate. Okay, and the blood flow will be good over here. Now, what's the clinical correlation? So that this mechanism helps in endothelial dependent vasodilations. But suppose if any patient is having atherosclerosis, in atherosclerosis, what happened? At the end, the endothelium get damaged. Okay. So when the endothelium get damaged in atherosclerosis, then what happened? This response will be gone because because the M3 receptor is present in the endothelium. When endothelium get destroyed, then there will be no this mechanism called endothelium dependent vasodilations. So endothelium damage, so the response will be impaired in those patient. Now we'll see how it works in the eye. Okay, so in the eye, we all know that in our very first video we talked that in pupil there is two muscles, one is radial muscles and one is circular muscles. So in radial muscles there is alpha 1 receptor that causes mydriasis, and circular muscle there is M3 receptor that causes miosis. Okay, so let's see, suppose this is your pupil, so this is your radial muscles. Okay, this outside, and this it has alpha 1 receptor and it is called mydriasis. Okay, the eye will be get big, and this inner side there is a circular muscles, then these circular muscles contain M3, and this causes miosis, decreases the size of the pupil. Okay, so when the M3 receptors, okay, M3 receptors over here get stimulated, it causes circular muscles, these circular muscles to contract, and when it contract, it causes pupil to constrict. Okay, so there is a drug called pilocarpine, it stimulates the M3 receptor. Okay, the M3 receptor present over here, and what is causing it? Causes miosis. Okay, so when it causes miosis, it helps to improve the aqueous humor drainage and helps in glaucoma. Okay, so sometime what happened that there will be this path. Okay, this path in the eye get blocked in the glaucoma, so the aqueous humor can't drain. But when we give a drug and it causes miosis, the size of the pupil get small and this road become big, so that the aqueous humor will comes out, and this will decrease the symptoms of the patient having glaucoma. Okay, so this is how it works in the blood vessels and eye. Okay, now we'll move forward and we'll see that how it actually works in the ciliary muscles. So let's see. So in ciliary muscles of the eye, there is also M3 receptors. Okay, so when these M3 receptors get stimulated, the ciliary muscle contract. When these muscles contract, then the zonular fibers of these muscles get relaxed and the lens become thicker. Okay, the lens of our eye become thicker, or we can say more convex, and this will the near vision, okay, the vision that we see from near, okay, that near vision will get improved. So let's see it's clinically. Okay, when we are reading a book or looking at your mobile phone like this, then it's required accommodations, and for that accommodations, M3 receptor is very important. How it's clinically correlated? Look, we all know that there is a drug called atropine. So when we put atropine in the eye, it will blocks the M3 receptor of the ciliary muscles, and what happened? Now there will be no ciliary muscles contraction, it causes relaxation. Now the lens flatten. Okay, when it's contract, the lens become thicker, but when it relax, the lens become flattens and the near visions become blurred, and this stage is called cyclopegia, and we actually bring this stage to for the examinations of the eye and to measure the refractive error of the patient. Okay, so this is how the M3 receptor works in ciliary muscles. So this is all we discussed about M1 receptors. After then we discussed about M2 receptors, and we discussed in detail about M3 receptor in all the organs.